So patients with type 2 diabetes mellitus have a 60% risk of developing dementia. It can be any type of dementia, but there are two commonest causes of dementia among patients with diabetes. And these dementia causes can actually coexist. So the commonest cause of dementia is Alzheimer's, like worldwide. That's the commonest cause of dementia. But the second commonest cause is vascular dementia. Now, we know that diabetes, it brings changes to the arteries in the body. The arteries in the brain, the arteries in the heart, the arteries in the kidneys, and the arteries in the legs. Especially poorly controlled diabetes, when the HbA1c is high or the fasting blood sugar is high. So these arteries become, narrowed and they start to accumulate cholesterol inside. It's like when you're using a highway that has traffic. So, traffic or maybe boulders have fallen on the road. So the traffic will not be moving. There'll be sluggishness in traffic. That is how the arteries behave when you have diabetes, which is poorly controlled. It accumulates cholesterol inside and calcium and just makes it difficult for blood or carrying oxygen and nutrients to reach the brain cells. So you know that the brain is very greedy and it uses oxygen through and through. And when there's a reduction in oxygen supply to the brain, because the arteries are narrowed and just, become a bit dysfunctional, then you can get vascular dementia. The other risk factors for vascular dementia, apart from diabetes, which is poorly controlled, is high blood pressure, cholesterol problems. People who smoke have a high risk for vascular dementia because it just changes how the arteries are. Obesity and lack of exercise usually can bring abnormality and dysfunction in the arteries that supply the brain. So usually vascular dementia, the symptoms, people usually come in with their parents, and usually the risk for dementia increases with age. So anyone above 70 is at risk for dementia. And they usually say for people with diabetes, the earlier the diabetes diagnosis is done, let's say you in your 30s, you get diagnosed with diabetes. So because you stay with diabetes for so long, then your risk for vascular dementia is so high, especially if the diabetes is poorly controlled. So usually people in their 70s are brought in by their families, and then they tell you, our loved one has memory problems, they are so forgetful, they're having mood swings, they don't want to cooperate, they forget to come for appointments, they even refuse to cooperate to take medicines, and that you just see that their personality is changing, becoming more moody, looks like they're depressed. So the risk, the suspicion should be very high if your loved one has had diabetes, especially poorly controlled diabetes for so long, and if they're having these other risk factors that I've talked about. So patients with diabetes can have Alzheimer's, dementia, at the same time vascular dementia. So what is the difference? So when you do, because the symptoms can be confusing, usually what helps us is the imaging, the brain imaging. So for vascular dementia, when you do a brain MRI, you actually see vascular changes in the cortex and lacuna infarcts. So it just means that this person has been having very, very tiny strokes, multiple strokes over time. And then when that, cumulatively, it leads to a lot of, changes in the brain. And the brain basically doesn't get enough blood supply. So there'll be lacuna infarcts on the brain MRI, which is, quite diffuse on the cortex. And for Alzheimer's dementia, what happens is there is atrophy on the hippocampus and the temporal lobes that you can see. And then for Alzheimer's, in this country, apart from doing brain MRI, we also do nuclear medicine, what is called PET scan, FDG PET, where they inject glucose that has a dye, and then that glucose that is loaded with dye goes all the way to the brain. And then now when you're doing the PET scan, you're just seeing which areas of the brain have low metabolism, because glucose is metabolized by the brain usually. And if there are areas that aren't receiving enough glucose, remember that glucose is tagged with radiation material, so you'll be able to follow it, and then you just see the areas not receiving enough glucose. Then you say those areas have low metabolism, and usually it's the temporal lobe and the hippocampal formation for the Alzheimer's dementia. For vascular dementia, MRI is just enough. And as I said, it will just show white matter ischemic changes with lacuna infarct. So how do you prevent, how do you treat? So the best treatment for dementia, and especially vascular dementia and also Alzheimer's dementia, because people with diabetes also get Alzheimer's dementia. So Alzheimer's is when there's deposition of a beta amyloid material in the brain, in the brain, so that there's that this atrophy in the areas I've explained. So prevention is everything. So for diabetes, making sure that the sugars are well controlled, bring the HbA1c to normal limits, 4 to 6. HbA1c is the glucose that is tagged to RBCs, and we'll be able to see in 6 months how the blood sugar control has been. And the fasting blood sugar should also be very well controlled. We prefer it to be below 7. The lower it is, the better. Between 5 to 6.9 on the fasting blood sugar. We also usually give patients statins, which are cholesterol medicines. These are also to prevent dementia. And then sometimes we even give patients aspirin, junior aspirin, especially after they've suffered a stroke. This is also helping to prevent vascular dementia, vascular changes. And then exercise leads to increased blood supply to the brain. Encourage people to stop smoking cigarettes, and diet, Mediterranean diet, which is basically fruits and green leafy vegetables for that diet. But prevention is everything, because once dementia sets in, it's really difficult. And for vascular dementia, the biggest symptom is difficulty in executing functions, like if you send someone to go and close the gate, they reach there and they don't know where to start. Or if you just give them a simple task to put sugar into their tea and to stir it, they are not able to do that. And then these things happen in what is called a stepwise fashion. So they deteriorate and then they stabilize over time, and then the deterioration is so major, so they fall down, like the deterioration just is major, and then they stabilize a little bit. For Alzheimer's dementia, it's just uniform deterioration, and it's mainly memory. Like they cannot store in new data. Like if you give someone with Alzheimer's dementia a book to read today, they will read that book, and then tomorrow this book, to them, they will think like they've never read this book, and they will want to read it again. So they can read the newspaper so many times and they don't retain any information inside the newspaper. So new information and encoding, anything that needs to be encoded now, they are not able to do that. For Alzheimer's, the memory decline is not so much, it's mild, but the executive functions are severely impaired. Yeah. So those are the functions, those are the differences, and prevention is everything, because dementia is becoming more common, and this is because lifestyle diseases are becoming more and more common. Diabetes is very common now, and most of our patients, the diabetes control is not good. It's not where we want it to be. So diabetes, as I said, affects the brain, affects the heart, affects the kidneys, affects the nerves in the brain and in the legs. So it basically affects every organ. And diabetes, sugar control is everything to prevent all these problems, including dementia that we've discussed. So go out there and help prevent dementia.